having said that, there are some special situations in which the fractures may not heal, especially when you consider what we call fractures of the femoral neck. There are some certain types of fractures of the femoral neck that the bone does not heal. And the reason for that is because the pipe that supplies blood to the head of that femur is also broken or transected or severed when the fracture occurs. So that bone becomes deprived of blood and so cannot heal back to the main bone. That's a special situation. In such instances, since we specialists know that is what happens, all we just do is to remove that broken head and replace it with another one, and that solves the problem. But for most other parts of the body, the elderly can heal their fractures if they are properly managed.
Good to know. That's actually fantastic. That's good to know. So also trying to understand something. Research every time and now has proven that fractures in the elderly can lead to decline in overall health generally. So I want you to share some of the long-term impacts of bone fractures on an elderly person's physical and mental well-being. So perhaps if they're able to know that this happens to be the long-term impact, then they would put more concentration and emphasis more on their their lifestyle and perhaps having to ensure that they prevent bone fractures.
Okay, so there's something that is peculiar about us human beings, and I think maybe other animals, and that's the fact that we need to move about. It is moving about that keeps you alive, that keeps you healthy. So anybody that has a fracture, especially in the lower limbs, and the person is not able to move, then a lot of other not good things, or not to say bad things, can be added onto it. And that's very special when it now comes to the elderly. Okay. Now, when you are not able to move, number one, the blood flow in the body slows down, and then abnormal clots can form, and that can be dangerous. Also, when you are not moving, your muscle bulk tends to also disappear. And also, all these things are not good for the elderly. The elderly needs to keep on moving. Once you keep an elderly person immobile, have pneumonias because the person is not breathing as hard as he or she should breathe. Can have, like I said, they can have blood clots, the muscle bulk disappears, can have bed sores and pressure sores. So many things can go wrong in the elderly when they have fractures that do not allow them to move about. Where maybe fractures of the upper limb, the person can still move, but when it comes to the fracture of the lower limb, which is very common, that immobility causes a lot of problems. So you don't want to keep them. So when these fractures occur, and they do occur, you don't want to keep them too long in bed. You need to find a way of managing those fractures that get them out of bed immediately and start walking again. But like we all say, I'm sure you're going to ask me towards the end of the program, what do you do? It's actually better to prevent these fractures, not to happen in the first instance.
Yeah.
But the fact is that whether we like it or not, they do happen.
They do happen. I think it's important that we also look at some of the risk factors and how these tend to come to play, and especially risk. I know we've previously spoken about how if it's the young adult, maybe you're playing football, you're on the road, you're on the move, you're going to work, you have accidents, you have injuries, one way or the other you fall. That can also lead to bone fractures one way or the other. But now let's look at elderly. What are the primary risk factors for bone fractures in the elderly? Because in most cases we see they don't walk. Unlike we youth, the agility is there, so you're always in a hurry. They walk slowly, carefully, so you don't see them fall. You don't. Although yes, I know you might have experiences. I want to get into certain human angle, interest shortly. But before that, what are the primary risk factors, at which these elderlies have these bone fractures?
Okay, we've actually mentioned this before. The primary reason why they are prone to having fractures is because their bones are weak. The muscles are not as strong as before. And the coordination between how the brain relates or coordinates the muscles and the bones during the act of walking has also decreased. So the ability to, for instance, break a fall, the reflex action that makes you to break a fall may not be necessarily optimal in an elderly. So little injuries tend to make produce very severe fractures. And then also the home environment. In our environment, for instance, that we always believe that the elderly, who often may be the landlord, should live upstairs. We have that air that the owner of the house should be living upstairs. And this owner of the house is often an elderly. But you see, during the process of trying to climb stairs to use our room, then you can have a fall on the staircase, and that leads to injuries. So one of the ways to prevent injuries in the adult and the elderly is to make them live on the ground floor, where they can go and come back without having to do unnecessary act of climbing stairs. Then also in the house, for instance, that we need to make sure that the kind of tiles you use in their bathroom are not the tiles that are slippery, so that they can, their foot can grip the ground very well. So sometimes you need to modify, just like you're saying, modify the lifestyle to make sure that they are not necessarily exposed to injuries. But we all pray to live old.
Yeah.
So the problem is always there. But the main reason why they have these injuries is because the bones are weak, the muscles are not working well, and the coordination, the general coordination they are working is also not as sharp as before.
And this occurs with every elderly.
Exactly. Every elderly.
Because I know that when it comes to seeing elders, I've seen some elders who, till their dying bed, they still, they're quite agile. They're still very, very much strong. And unlike some. So I don't know if this has anything to do with genetics or if it has anything to do with lifestyle. What would you say has to do, comes to play when we see results like that?
Yeah, well, generally, if you are the type that exercise a lot or are engaged in, shall I say, hard work, in quotes, it tends to actually prepare you for the elderly, And then it also has to do sometimes with your body habitus.
Okay.
For example, you see chances that maybe people who are slim, they tend to be more agile when they are elderly than people who are on the plump side or on the big side. Things like that do occur. But sometimes too, being also overactive can also be on the other point.
Can you help us break it down? The first quote unquote you said was hardworking. Now you're saying overactive. So can you help us?
If you're the type that exercise very well and you build your muscles and bones when you are younger,
yes,
it tends to protect you when you're elderly and not doing so much because you have built up a reserve that you can use when you're elderly. Are you getting me?
Yes.
I also said that sometimes your body habitus, that slim people tend to be more active when they are older than people who are heavier, and that's just common sense. You are light, your energy can carry you. But when you are heavy, your energy may not necessarily.
This is the first time I'm proud of my lanky self.
But I'm also trying to say that for the fact that you are able to be very active
yes,
when you are elderly does not now mean that you should overdo it. Because when you are too active again, you're also prone to having injuries. So one has to strike a balance to make sure that everything is okay.
Exactly, because it brings me to my next question. We've seen cases of maybe the Arnold Schwarzeneggers of this world, some persons who, during their youthful years, in fact, the large life of their years, they used it strength in the gym. So you see them well buff and so macho and the likes. And according to reports, one way or the other, as they age, all those muscles they've amassed just falls off. And it's as though some persons there's been some sort of misconceptions where it seems like at the end of the day, it doesn't necessarily work to their good during their latter years. So I don't know if you'll help us, demystify that.
Yeah, see, when you're in your youthful years and you are exercising very well, or let's use the one when you're pumping muscles.
Yeah.
You build up those muscles, okay? Now, whether you like it or not, when you're elderly, you lose them. That happens to everybody. But even in that loss, most people that have exercised when they are youth, will still have better muscles than those who did not.
Okay.
So just like you said that those muscles have literally fell off. Are you getting it?
Yeah.
The fact is that what they have at that time is probably still better than their contemporaries who never did maybe better protection. But the fact is that little can have injuries too. But they will still be, if you are supposed to, if you weigh it or if you put it on a scale, they probably be on a higher preventive scale than those who did not exercise at all.
I see.
But the fact is that you cannot keep your muscles forever.
Yeah, absolutely.
What kept those muscles is the fact that you are always exercising them. And when you are elderly, there's no way you can exercise them the way you used to do when you are younger. So the muscles stay forever.
Fantastic. Lagos, let's talk to a doctor here on WASH 94.9. I'm talking about bone fractures in elderly. You're listening to the voice of our doctor, Dr. Olatunji Idowu. And of course, he's going to be sharing, of course, as he's been sharing light on the conversation. We'll go for a quick breather, and upon return, we'll put up on the phone lines, get your questions, get your thoughts on, on our subject matter this morning on Talk to a Doctor. Stick around.
I am Aki Fatuke. I keep my dial on 94.9 FM. So keep listening to WASH FM 94.9. Don't change the dial.
WASH 94.9. Type 2 diabetes is a serious chronic health threat. It affects tens of millions of people. Many people who have the disease don't know it. Diabetes can cause health problems such as heart disease, strokes, amputations, and blindness. Talk to your doctor, get screened if you're at risk, and learn how to avoid becoming one of the millions of new cases of diabetes each year. You can help prevent type 2 diabetes.
This message is brought to you by WASH 94.9 FM and supported by Flock's WASH Health Foundation.
Hello, everyone.
Looking for a reliable health solution? African Biomed Test has you covered. At African Biomed Test, we offer cutting-edge solutions to newborn screening, paternity DNA testing, digital cancer screening, and non-invasive prenatal screening to protect your family's health. Convenient, accurate, and trusted care for everyone. Visit us at www.africanbiomedtest.com or download our mobile app to buy your test. Have your sample collected at a nearby location close to you or do home collection. Then, get your result delivered to your phone in the comfort of your home or call 0814-538-6422. That doubles as our WhatsApp number. African Biomed Test, your trusted partner in health.
The first and only authentic health radio in Nigeria.
WASH 94.9 FM.
All right, welcome back, Lagos. It's 9 minutes after 10 and still talk to a doctor. You can be a part of the broadcast this morning by calling the studio line 0906-099-2609 for your questions on bone fractures in the elderlies. Dr. Olatunji will certainly attend to you. So you can call the studio line. It's 0906-099-2609. You can also reach out via text and WhatsApp via the number 0915-849-4949, 0915-849-4949. That's also where you can relay your thoughts via text and WhatsApp. So coming back to you now, Dr. Olatunji, I want to clarify something because at times it's not every older adult that can afford perhaps a caregiver. So many older adults will live with a sense of independence most of their latter lives or latter years. So when a fracture occurs, if eventually a fracture occurs, it can be quite it can be a life-changing event if they have no one who is around them to, take them to the hospital and the likes. So I want you to help us share some, experiences. This is your specialty. But before I go on with this question, let's just take our very first call this morning. Hello, good morning to you.
Hello, good morning, sir.
Good morning to you. Is this Alaja?
No. My name is Oladele. I'm calling from Ikorodu.
Mrs. Oladele, good to have you calling on Talk to a Doctor, WASH 94.9 FM.
Yes, I want to ask a question from the doctor.
Yeah, he's with you.
I'm an elderly person because I'm 65 years old.
65.
So,
You're 65.
65, yes, 65. So I listened at the initial stage that our brain is made up of calcium, which is a material. So I want to ask, since somebody is getting it now, so can I buy calcium supplements, to replace the way I had calcium in my brain, or in alternative, what are the recommended foods I should eat, to maintain the calcium in my brain, so at least it's right. So that's my question. Thank you very much.
Thank you so much, Mrs. Oladele.
Thank you very much, ma. Yes, you can take calcium supplements to maintain your calcium level. And you can also, eat normal food that contains a lot of calcium. There are so many items that you can do. But sometimes it's also necessary to check with your doctor so they can check your calcium level and make sure that they are okay. And then also, there are some class of people that lose their calcium faster than normal. And that condition is called osteoporosis. They may need some extra treatment to maintain their calcium level. But for the general population, what we just advise is that they should take calcium supplements when they're getting older. I hope that is clear enough, man.
She's off the call, so she's definitely going to listen over the radio. All right, thank you so much for clearing that out. Lagos, you can also be a part of the broadcast and send in your questions, 0906-099-2609. That's the number to call. You can also reach out via text and WhatsApp, 0915-849-4949. So I was trying to clarify certain things on, older adults who perhaps, have this sense of independence. And I want you to share some experiences that you've had, where with real life stories of elderly individuals who faced fractures and how they were able to navigate their recovery, how they were even able to go about, getting to the hospital without, the aid of caregivers. Certainly, we're going to get into, how they can get treated, but we just want to learn.
Okay, thank you very much. I see in the time past, I like the African traditional way of taking care of our elderly. In Nigeria, people don't usually leave the elderly alone. It's always somebody that is around to either live with them or at least be observing them as they go about their normal daily activities. But increasingly, right nowadays, we are turning to the Western culture in which sometimes elderly are just left alone in the house. Okay, an incident happened just this last Christmas when I was called by somebody. It happens that their mom, who is 93 years old, later when I saw her, she was very slim built, very agile. I learned that earlier in the day, she actually went to a function, and when she was getting back, she couldn't find transport, usually Okada. It was somewhere around Iliwon in Lagos State.
Okay.
So she actually walked like 5 kilometers.
Wow.
From that function.
93-year-old.
Yeah, 93-year-old.
Without the help of anybody.
She was that active. Of course, she wasn't working alone. She was working with other members of the family that come back from the same function. But after she got home and then rested, she was about to go to the convenience, and she just slipped and fell. And it was like she was having pain around the hip. And then everybody just thought, oh, don't mind Mama. After walking 5 minutes, what do you expect her to? That kind of thing.
Yeah.
So everybody just say, oh, rub this, rub that. But I think about 2 or 3 days after, now they got really worried that, Mama is not usually like this. So, normally she would have gotten up in the morning and do something, but now she's not doing that. So we need to check her out. And thank God, they took her to Bangkok University Teaching Hospital, which is in Iliwon. I told you.
Yes.
It was there that the doctor there or the medical officer there did an X-ray, and it turned out that Mama had a fracture of the hip. So such things do occur, and then of course once you have a fracture of the hip in the elderly, if you want that elderly person to still continue to walk for them, you need to do a surgery called we call it arthroplasty or sometimes total hip arthroplasty. You just have to substitute the head that was broken, and then once you do that, In another 2 or 3 days, my mom was back on her feet, and it was like somebody had done a miracle. But really, it's just a normal expectation if you do the right thing.
Okay, and after there was a surgery done.
Yes.
You know, usually, even in the younger adults, when they experience surgery, they may be a little, they might have to get some reactions one way or the other. They don't, maybe they're having to deal with one pain or the other. They don't go, what about that?
See, most surgeries are actually safe. I will just do that. You see, surgery is like a process. When you want to do a surgery from somebody, it's like, it's like a checklist or a pathway that you must follow. And once you follow those pathways specifically, usually the outcome is good and the complications are very low. But it's just like there's nothing in this world that you do that is 100%.
Yeah.
Okay, so occasionally you may have some complications. But for most people, things go right. Unfortunately, if things go right, you don't get to hear about it. It's only when things go wrong that people talk about it. That's why it seems like surgery is a difficult thing or something like that. Now, particularly when you apply that to elderlies, you know, before you even try to do surgery for them, you know that this person is elderly. The system has worked, like that lady I've referred to now. Somebody's heart has been working for 93 years. So you don't expect it to be like the heart of a 45-year-old. Same thing for liver, the kidneys, the everything like that. So before you attempt to even do operation on such people, you need to pause for a while and check all those systems out. Analyze them, do the relevant tests to see, are those systems good? Can this person withstand the surgery that you are planning to do? Then, once whatever answer you provide, if the person needs some initial treatment, then you don't do the surgery immediately. You make sure that you treat those systems to make sure that they are working normally, acceptable for the surgery that you want to do. And then once you have reverted all those systems reasonably back to normal, then you can go ahead and do what you want to do. And you can be assured that there's nothing will happen. Everything will just go as you have planned it. Like this lady I was talking about now, the only thing that was wrong with her was a certain amount of blood level you expect the person to have. She fell short in that. So what we just did was to give her blood. Make sure that that minimum level was reached. Then we did her surgery, and then we also gave her more blood. And 2 days after that, she was walking with support. And when she was going home 2 days after, this person I'm talking about stayed only 5 days in hospital. All this thing we're talking about, from admission to discharge, it was just 5 days. And she walked home, and she's still walking now. She came back to the hospital, I think about 2 weeks ago, to have her stitches removed. But she had gone home, and she was walking. She came back to the hospital herself walking. So some of these stories, when you hear it, it was like, is this magic or is it a miracle? No. It's just a normal thing that happens when you do the right thing.
That also brings us to the question of, finances when it comes to health and all of that. But before we get into that, let's not amplify on prevention, because time and time again, we always amplify on the need for prevention better than cure in any given circumstance as far as health is concerned. So is it possible, are there any strategies that can be implemented or might have been implemented in order to prevent bone fractures in elderly? Is it possible?
Yes, it's possible. Or rather, you cannot prevent every one of them. You can only minimize it or make sure. Like I mentioned before, for instance now, don't have elderlies doing unnecessary action, like climbing stairs and coming back. If you have an elderly in your house, it's better for them to live at ground level.
Just like you said,
yeah. That's one. Then make sure that there are no slippery areas. Don't leave pools of water or droplets of water on the tiles anywhere in the house, because it's easy for them to slip on those things and fall down. Okay. Then also don't have them reaching up to carry to take things from places that are too high, or make a situation which they will be tempted to maybe stand on a stool to pick something from a higher level. Because then, like I said, muscle incoordination, imbalances, they can fall down. And those trivial things that you and I will just, just pick ourselves up, it's not to break their bones. And you just find out that this little fall that Mama has. Then I would also like to talk about a situation which I've seen many times, and that's when you see a grandmother trying to maybe discipline a younger, let's say a grandchild. And I've seen that situation many times, and then the grandchild just dodged the mama, and then before you know what's happening, mama is down, broken her hip or broken another bone. I've seen that several times before. So little things like that, we try and make sure that they don't happen. And then of course we should always pay attention to our elderly, make sure that they are comfortable, they are well taken care of, because everybody is praying to the elderly, so it's going to be your turn one day. So, and I believe that what you sow, you reap. So we should take very good care of them, and also check them out. Sometimes they have injuries too, and they may not actually know. They may not, elderly people are always complaining about pain here and pain there and pain. So sometimes when they sustain injuries, it might just be little pain, but if you are not really paying good attention to them, you might not know that that injury is actually very severe.
So, just like you hinted in the story you shared with us now, I know youth, they would advise do more walking, do exercise. It will help you. So, would you recommend that elderlies go through that kind of walk that she did? Like for instance, that 5 kilometer walk.
They should also exercise, but it should be the kind of observed, or there should be somebody that is supervising them when they're exercising, not just left alone to do whatever they like. It's also muscle coordination exercises, things that you can do to make sure that they are well groomed, so that some of these injuries can at least be prevented. But whether you like it or not, some injuries will still happen.
Absolutely,
that's just a reality of life.
So, simply put, the 5 kilometer that our 93-year-old grandma walked, you don't think it's too strenuous for her and elderly?
Well, to be very candid, from what the children told me, she's actually used to that.
She's used to it?
Yes.
Okay. All right. So, Lagos, we're still talking prevention. So, we're going to now look into...
And of course, that's the what caused the injury.
You mentioned that. Just wanted to be sure, especially for the benefit of our elderly listening, and also might want to, gain more from that story. So Lagos, not forget you can be a part of the broadcast this morning. You can reach out via text or put a call through the line. It's 0906 099 2609 0906 099 2609. Text and WhatsApp is 0915 849 4949 0915 849 4949. Now we're going to go into management and treatment, because at the end of the day, it is what matters if eventually there is a fracture. So the question is, what's the way out? We see certain persons, especially elderlies, who perhaps did not budget adequately for health emergencies, and in the process of a health emergency like bone fractures, maybe not having enough funds, not having enough, just like you said, community or some people that can help with funding. You see them relegating to maybe walking sticks and the likes, or trying to just just manage that pain on their own little way without having to go for treatment. How then would you what would you have to say about this? And besides, what are the ways at which they can manage bone fractures adequately?
Okay, before I answer that, actually, since you mentioned walking stick or something like that, actually that's one of the preventive ways of trying to assist the elderly in preventing fractures. We should also encourage them sometimes when they are not able to walk well on their own to use walking aids, walking sticks, walking frames, things like that. When they use it, actually to help them to prevent having fractures. And I know that elderly people don't like using such things, but you have to find a way of compensating them. I remember my late mom, when she was like 82. I noticed that she wasn't working well, so I bought a very nice walking stick for her. But then she was still like,
why, I'm not that old.
She was telling me that Mama Lagbaja is older than her. She's now using walking stick. And I told her, I said, look, maybe Mama Lagbaja didn't have anybody that can buy walking stick for her. Yeah, but me, I'm buying you this walking, you must use it. And of course, she started using it. And walking was better. So that's one of the preventive ways you can do that. And then now coming back to your question, you see, for this class of individual, that's the elderly, it's very, very important that their fractures are managed promptly. Because if you don't do that, it may just be a one-way ticket back to their creator. There are some fractures that once it happens and the person is on bed and unable to get up, they die faster than they would have been if there was no fracture. So it's important that the injuries are addressed promptly. But then the problem here in Nigeria is that most people don't have health insurance. That is the basic problem. And sometimes when you have health insurance, this kind of health insurances don't cover most orthopedic procedures. So most people, not just the elderly, the ones that have an orthopedic injury, they have to pay out of the pocket to fund it. So now this is where the problem starts. And that's not everybody that can afford to do what is right. We all know what is right.
Yes, true.
Like I said, for this lady we are using as an example now, number one, she has good children. I get it. And they're also well educated. So when I explained to them what they needed to do to get their mother back to her previous level of activity, they quickly understood it. In some instances, you tell the people what they need to do, and sometimes they understand, but sometimes there's no money to fund it. Unfortunately, for this kind of injuries, most elderly, when they have fracture like this, most of the time, you need to do a surgical procedure to get them back to normal, especially when it is in the lower limb. For the upper limb, yes, you can get away with many non-operative procedures to heal their fractures. But for the lower limb, you probably need to do one form of surgical procedure or the other. And then it's also things that you should do quickly. So finance, like you mentioned, is a big problem. So we can only pray. For some of them, of course, some of them, God blesses them. I mean, they're well-to-do. So sometimes funding is not it. And a lot of the time, too, the children can also put heads together and fund the treatment of their parents. But just like you said, there are some class of people that no matter what you want to do, the finances just don't come up. And I think this is where the problem really lies. And whatever you do for them in terms of, they may not just be adequate. And such people may just become immobile, like I said, and then your guess is as good as mine what happens to them.
All right, Lagos 10:30 here, Wash 94.9 FM. The program is Talk to a Doctor. You're listening to Dr. Olatunji Idowu. He's a consultant, special grade 1 at the Orthopaedic and Trauma Department at the National Orthopaedic Hospital, Igbobi-Lagos. He had subspecialty training in Special Orthopaedic Fracture Management. He's also a fellow of the Faculty of Orthopedics, National Postgraduate Medical College in Nigeria. I could go on and on, but of course, just to let you know the caliber of doctor we have live here in the studio of Wash 94.9 FM. And now let's talk about, for family members, caregivers, who tend to witness an elderly, a loved one suffer a fracture. It can be quite emotional, quite overwhelming. So what advice would you give to families providing both physical and emotional support during recovery, or caregivers? Because, most times, just as you said, once upon a time, I think things have changed. Where we had, they'll send your family, a loved one, a relative, go and take care of mama, go and take care of papa, go and be living with mama, go and be living with papa. But these days, obviously, some people still practice that. So, in other words, some don't necessarily have qualified hands to look after, elderlies in the case of, fractures or what have you. So, how would you advise, families and caregivers as such?
Well, thank you. Just like you said, we should not be leaving our elderly people to live on their own. We should always find a way of having a family member look after them, or at least supervise them. Okay, and if a family member cannot do that, I think one can get a caregiver. And actually, that practice is also very, very common now. Yeah, for those who can afford it, they have somebody, a caregiver that is always staying with elderly people and observing them very well. But I think what is important is that one should really, really observe those elderly very well. If you notice any change in their activity, or maybe having more pain than usual, or not working as well as they are working before, sometimes it may just be like that unwillingness to work. Somebody, gets up in the morning, does this, or can at least groom him or herself, go to the bathroom, do this and do that, and then one day you just see that the person is very reluctant to do it. One should investigate the reason why that is happening, because it might just due to the fact that that person has sustained an injury. So we should have a high index of suspicion when we are taking care of these elderly people. And I think that elderly should not be left alone to be on their own. I think we should do everything to prevent and make sure that that doesn't happen.
All right, I want to ask something that is a little off the script, because you shared an instance with your mom and how you had to get a walking stick or walking aid, right? So the youth, to an extent, they see walking aid as some sort of fashion. And ordinarily, we know that it's meant to be a walking aid, just as the name implies. So you've also had experiences, you've seen persons. So this is a question for the youth. So I want to know, in your experience, how do older adults, elderly, feel about, using a walking aid? How do they feel about it? And besides that, their steps. Do you think that walking aid makes them feel comfortable? Just like you hinted, you recommended a walking aid, and she felt, I'm not that old now. I know that I might be a little fear, concern. God, am I getting that old? So how would you, help, clarify that?
I think, well, the way I will answer it, I will say that I think there's something with us human beings that we really don't want to believe that we are old. If you look at it, sometimes, like sometimes when I attend an old boys association school, I look at my friend and I look at myself and say, am I this old too? That kind of thing. You wonder, am I this old too? And then sometimes, like me for instance now, in my hospital, I've been there for a long while. And then somebody meets me in the corridor and say, Daddy, good morning. And I was like, who's Daddy? This person talking about, is it me? And then you need to wonder, am I looking so old? That kind of thing. Even though I don't really have any problem. But the fact is that some people start calling you Daddy in the hospital, and other you just have that feeling that am I this old? So I guess that is what happened to my mom too, when I said, I knew that she wasn't working when she was coughing of knee pains and all that. And I said, Mommy, you need to use a walking stick. So she knows that I'm an orthopedic surgeon. And then she was like, my elder brother is not using my elder brother is not using walking stick. Why should I be doing walking stick? So I said, doesn't matter. Your older brother is working better than you, but you are not working well and you need this walking stick. Okay. And then we went through arguments here and there, but eventually she accepted. And she now found out that it was actually better. But of course, I made sure I bought her a very nice, fancy one. And I said, you should make swagger with it. Let people know that this one is taking care of you.
That is it. That is it.
So,
All right.
But there's no doubt about it that the elderly benefit from this walking aids.
Okay. Our time is really fast spent here on the broadcast this morning. But is it possible that before fracture occurs, an elder or older adults might not necessarily know that they are feeling weak? They don't necessarily. Is there any sign to tell before a fracture occurs that you might be feeling weak somewhere?
No, I don't.
You must know.
I don't think that's really applicable.
Oh, okay.
Some of these things are really quite sudden, actually. It's very sudden. Very sudden.
So, in other words,
in fact, it has even been described that sometimes when, like that fracture of femur that I told you about now, or the neck of femur, that sometimes the fracture even just happens on its own. You don't even need, that the bone is so weak that even ordinary standing, that is actually because the bone actually broke that make the person to fall down, not even that it's the falling down that caused the fracture. So sometimes there's no sign, there's no...
Just happen like that.
Just because the bones are weak and all that. But in some instances, some may be having pain. They may be having pain in that area for a while. And that pain may be, it's like an indication that there's not all wrong in that area. And sometimes some of those fractures, sometimes you can just pick them up before they actually happen. Like maybe somebody is complaining of pain around the hip, and then it was severe enough for you to say, okay, go and take an X-ray. And then you just see the picture of the X-ray that the bone is so thin that you know that this bone is going to break very soon. And sometimes it does break.
Thank you so much. Even as we close, I'd want you to recommend certain lifestyle one can engage in on a day-to-day basis. I know people talk about calcium and how it helps, for healthy bones. I don't know what you would want to say about that, even as we wrap up the broadcast this morning.
All right, just to say that while we are young, while we are yet young, we should exercise very well, build up our muscles, build up our bones, so that when we become old, then we can still have enough reserve to last us a long time. And also to maintain our bone health by taking the appropriate vitamins and calcium, and also to make sure that we are careful